Medicare versus Medicaid. 5 things you need to know. What is it? What's the difference? Who qualifies for it? Can you have both? And if you have both, who's primary? Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance, and this is the CB Health Insurance YouTube channel. Welcome. Today's video, we're going to cover Medicare versus Medicaid. 5 things you need to know. Before we get started, don't forget to subscribe to the channel. Hit the little bell so you get future notifications when we release new videos, which is about every 2 weeks. Tell your family and friends, and don't forget to like the video. Give us a thumbs up. Now on to today's video. Medicare versus Medicaid. What is it? Both of them offer health insurance programs, but what's the difference? Medicare is a federally run program, right? Medicaid is actually a joint program between the states and Department of Insurance and the federal government. The federal governments give the states money to manage and run their programs. So they do vary by state a little bit. So, who's eligible? Well, Medicare is really simple. You turn age 65, you are eligible to enroll in a Medicare program. Or if you're under 65 and you've been disabled and receiving Social Security disability benefits for 24 months, 2 years, then you qualify. And there's a couple of conditions. If you need a kidney transplant, if you have Lou Gehrig's disease, you can qualify. But the majority of people are over age 65. Now, one side note, one caveat is that in order to get Medicare Part A for free, you have to have paid Medicare taxes, worked in the U.S. for 10 years, and pay in 40 quarters, either you or your spouse, and you get it for free. If somebody comes here from another country and they've been in the U.S. for 5 years and they turn 65, they can enroll in Medicare, but they have to pay more money for it because they haven't been subsidizing it. So that's a little aside. Who's eligible for Medicaid? Medicaid really provides health insurance to people with limited income and limited assets. So it's designed to help children who are coming from low income households. It's designed to help pregnant women. It's designed to help those people that are disabled and can't work and are of low income. And last but not least, anybody that's low income or below a certain level, regardless of age. They can be over 65, under 65. So Medicaid, aid has got the end of it. Aid, Medicaid is for low income. Now, there is a guideline, and the ACA, the Affordable Care Act, expanded what the qualifications were for Medicaid. Some states expanded, some states did not, but the state of Illinois, it is what most states have, which is 138% of the federal poverty level. The federal poverty level, the government sets every year. You can Google it and look at the guidelines, what the income level is, depending on the household, the size of your family. And if you are below 138% of that number, you qualify for Medicaid, generally speaking, right? There is an income related as well. Now, can you have both? The answer is yes. You can have both Medicare, right, for people over 65 and those disabled, and you can have Medicaid. Because of a low income, you qualify for Medicaid. So who pays first? Always, 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 always Medicare. Medicare is primary, but Medicaid is designed to pick up where Medicare leaves off, and there are different levels of Medicaid. We're not going to go through it because there's a lot of acronyms. There is partial qualifications to full qualifications, and some of it will pick up if you are fully eligible. In most cases, they pay everything. They pay your premiums for Medicare, they pay your co-pays, your deductibles. You have little or no, usually zero out-of-pocket costs, and it's on a sliding scale. Okay, now there is a name for people that are eligible for both Medicare and Medicaid. It's called dual eligible, and there exist programs for dual eligible individuals to get drug coverage, because Medicare is your primary, it's A and B, but you need drug coverage as well. And so those people that are eligible can enroll in a D-SNP plan, a dual special needs plan for people that qualify for both. Now, state of Illinois for the last 14 years had a program specifically for these people. It was not called a D-SNP. It was managed and run by the state. Different insurance companies participated, but you didn't go through an agent. They automatically enrolled you. That program is going away starting in 2026, and I'm happy to report that we will now be eligible to enroll people in a dual eligible special needs plan. There's going to be 4 carriers in the state of Illinois selling these plans, and if you have full eligibility for Medicare, you can't be partially eligible. You would qualify. You want to take a look at that. So be sure to talk to an agent during the annual open enrollment. So, can you have both? Yes. Who pays first? Medicare. Now you know. What is the difference between Medicare and Medicaid? Medicare is the federal run program for people over 65, those under 65 that are qualified because of a disability. Medicaid is health insurance for low income individuals, right? They can be under 65, they can be children, they could be pregnant women, they could be disabled. But if they're over 65 and or disabled and on Medicare, they're considered dual eligible, and the Medicaid picks up where Medicare leaves off and making them whole and providing fantastic coverage. So we hope you found this helpful. Until next time, this is Kathy Bukowski, the owner of CB Health Insurance. Thank you for watching.